Hello, I'm Dr. Joe Clarke with Copacetic Health, and I'm here today with Enot, who is a veteran, retired veteran, and has had quite a few experiences with injuries and issues, and you've addressed them in many different ways.
Yes, sir.
I met you when you came here to address them using acupuncture, and I was hoping that you could talk about sort of the things that you've experienced with taking care of your body based upon what you put it through, both in the military and as an athlete, and what you found to work and what you found hasn't worked.
Well, I consider myself an athlete, even though I'm maybe on the lazy side of it, but I've always exercised. I think I put my body through a lot of strenuous things, but besides that, I've had accidents, car accidents, broken backs, pelvic bones, spinal fractures. I have had it all, man. Tendons ripped. The last 7 years, I might have had maybe 4 surgeries regarding tendons. And I just consider myself going back to the basics, where you have to kind of eat right and not worry about the medicines that today's world wants to give you. So I started thinking more of, therapies, different therapies that you can get into. And luckily I ran into, I've done acupuncture before, and I didn't figure it was the same. Like it was just something that, a lot of talk and so forth. And I'm starting to realize that it's more of the experienced doctor that you go to. And so when I met you, Dr. Clarke, it was something different, like where I started feeling where I feel a lot of pain in my life, and I get a short fuse. Like I'm quick to anger because I guess I have no patience for things. Once it comes to fruition, I lose it because I'm already wasted all my patience on the pains and the things that I'm trying to kind of be a group and gather and keep together. So I started realizing that as I came to you, I've had more of a release of that, like not so much pain. I started realizing that the acupuncture was releasing more of that inflammation, that stiffness, and I was able to find a more of a peace, a middle ground to start kind of function correctly. I have 2 children, and they're almost adults, they're teenagers, coming and going and taking them, and then some of them want you to work out with them because they see that you're in shape. It's a little strenuous at times, and you've helped me out through this process.
Yeah, you're amazing to work with. So when you come in with particular sort of aches and pains based upon past injuries, based upon what you're putting your body through. Do you mind sharing how old you are?
I'm 53.
You're 53, and your body's in incredible shape.
Mm.
You work out consistently. You keep it in good shape. But at the same time, by doing that, you develop sort of like aches, pains, restrictions, and so forth, right?
Right.
And then you sort of come in with those, and you come in with maybe like a past injury that's flared up,
mm-hmm.
and then we address it. And what's your experience with that?
Well, my experience is that there's a lot of work that I still need to do. And as I came here and I started realizing that you kind of relieved me from that pain, it's almost a starting ground. It helps me kind of move forward in learning to, because it's, life is always a learning experience. You keep building. And so I started learning how to get back to the basics and started working out a little bit better. But the only way that I was able to get there is because you relieved me from some of these pains, like the aggravation in my shoulders, the elbow, the hip. Last time we even spoke that I wasn't able to run because of my Achilles. And then once I went through your process of acupuncture for a good, 2-3 weeks, man, I was running 3-4 miles. Like I was feeling different. And because the conversations that we've had. And so it kind of led me back to, you have to do things correctly. Because, in life you start kind of rushing through things. Everything's always a rush. And you stop going back to the basics when you start working out. And you know how to work out, but you do too much, too fast, all the time. Don't give your body rest. And I realized as I come here, and acupuncture, believe it or not, it's beautiful because you come and you get a little service. And in the process, as you wait for it to all kind of activate, you're taking a nap. So it's taught me to kind of step back, and not take life so head on. Man. It's giving me a lot of relief from the pain.
Yeah, I can speak for myself. So when I was younger, I was an athlete. and I would just push my body. In fact, I loved that feeling of pushing my body to the point of it being in that particular type of pain where you really like push it, because you know that it's kind of getting stronger, right, when you're doing that. And when I found, and I'm 47 now, what I found, when I try and push my body in that same way, there's pushback.
Correct.
Right? And so I have to, in many ways, relearn how to work my body now. Like, I still want it to be strong. I still want it to be agile. I still want to be able to, be active from sunrise to sunset, right? But I have to do it in a different way than I used to. It's like what you're saying. It's like you don't push past the edge quite as much, or if you do, then you take a step back so that you give some time for everything to work its way through. And what we do here is we improve circulation, reduce inflammation, so it allows for that recovery time to sort of speed up. And also, so much what I've learned in my own process is so much of what happens is the nervous system kind of, it doesn't bounce back from things as much. So if I push my body to an extreme, force it to an extreme, then the next day the nervous system is acting like I'm still in that place.
Correct.
Right? And sometimes even if I can't properly sort of stretch, recover, take things that will help reduce inflammation, promote circulation, and so forth, like even the next day, it's still stuck in that place, and it's stuck, and then I become stuck. Like my whole way I go through life becomes stuck. And I think that's what you're referring to, with like just that feeling of restriction in your own body and the negative feedback that you get just from being in your own body. And then when you're dealing with that, and it kind of eats away at your tolerance, and then something from outside of you comes in and that you have to deal with in some way, and you're like, I don't have the patience for this.
Correct.
Right. So that when we alleviate that and there's more fluidity in the body, there's less restriction, there's less pain and so forth, then you see its effect in your everyday life.
Yeah. Well, as you stated before, when you're younger and you're pushing your body to the limit, of course you recover so quickly because you're young, and being an athlete, you feel like as if you can handle that all of your life. Mm-hmm. But when age creeps in, you start realizing that your healing process ain't the same. Mm-hmm. And that's where you stay stuck, or it's the pushback, and you kind of feel almost lost, like, oh my God, like what am I going to do? And so, being an athlete and knowing that there's other things, there's yoga, there's stretching, there's this, there's that, there's therapy, there's acupuncture, we start kind of using your mind to go to these different avenues in order to relieve yourself. And that's where I'm very spiritual, so, I thank God, but I sit back and I realize that sometimes we do have to step out of the norm and go and take care of ourselves as far as getting this therapy, going to an acupuncture, going a step above and beyond to kind of make yourself feel better. Because when you're stuck, you feel as if you can get through it. You can do it, you know what I mean? And you push too hard, and then you set yourself in a position where the injury will become permanent. You know what I'm saying? And just to state that, my problems are, and I just realized it, and I think you don't know them. I got back some information from my doctor where I had tears in my labrum, tendons in my back of my shoulder, tears in my front of my shoulder. I have a tear in my upper bicep. In this one, I have what they call atrophy, and because of what we just talked about, the neural pathways, right? The inflammations, right? And they say that I have on both shoulders the same kind of aggravation, and it's supposed to be frozen shoulders. And I can raise my hands, I can still lift, I can still do things. And I'm thinking it's because of the tendency that I have to go to other options, acupuncture, the stretching, some yoga. But most of all, I think that your process alleviated me from the inflammations, allowing me to add to the stretching, letting that blood flow, because in our blood there's natural healing properties. We spoke about that. where it just, if you do it long enough, you're not going to have a day and night, you know, you're not going to have it the same week, but you do it long enough, you know, the process in a month, you start seeing a lot of change. In 2 months, you start seeing more change. And that's, next thing you know, as we did, when you started alleviating me from the pain in my Achilles, I'm running 3 to 4 miles where I can only run a mile and a half maybe without, and then have to take a couple of days off, you know, and not feeling good and the soreness and everything's tight. It took all that away. So sometimes people don't understand that there are other procedures other than medical and medicine. You know, you can go through a homeopathic, I'm thinking, acupuncture is more homeopathic because it's not medicine, it's not chemical.
Yeah, well, I mean, it's different. So it's a different type of intervention. It's an intervention that creates the conditions for the body to function better on its own rather than relying on something else, right? And so it's proven over time that can create those conditions when it's applied properly. So that it's really interesting what you bring up. So oftentimes, if you take imaging of something, especially if you're older, so for instance, you take imaging of the back, right? Basically, everybody over the age of 40, 45 has some spinal issue, right? Yes. Whether it's just stenosis or you know, there's shrinking of the spaces in between the vertebra, whatever it might be. Everyone has an issue. But some people, that affects their function and they have pain. And some people, it doesn't affect their function and they're completely unaware that there's a problem, even if they're pushing themselves as athletes. And that's what's so interesting about the body. It's that it's not black and white. In fact, as long as you promote circulation, reduce inflammation, and stress is managed properly in the nervous system, the body can overcome almost anything.
Right. It gives you the motivation.
It gives it, it's like the ability is not dependent completely upon the underlying structure. Right. There's lots of other things going on. Right. And so it's a matter of creating those conditions. Fairly on in my career, I was working with a triathlete, and she had frozen shoulder and tore her labrum in her shoulder like 2 weeks before she was going to do this triathlon that she really wanted to do. And the person she had seen, the MD she had seen, said, "Oh, you have to have surgery." You know, sorry. So she came to me and she said, "If I come every day, do you think I'll be able to do this race?" Mm. And I said, "I don't know, but we can try." No problem doing it. She's since done. I mean, that was 12 years ago, maybe 13 years ago, and I still know her, still interact with her, and she has continued to do triathlons and has never had surgery. So how do you explain that?
It's it's more of a fight or flight, right? There's people that they get an injury and it's, oh my God, I can't move it, let me sit back. And some doctors that want to give you medicine instead of treat it will say, well, you need to rest it. And in the sense of resting, the comfort, the laziness creeps in, and it's more like they'll feel better, but then there's limited use of that shoulder where they don't exercise it, they don't do anything for it, and eventually something that's already bad is going to turn out worse because now you're letting it sit, you know, again, you start getting that atrophy or what have you in that shoulder, the bad circulation, the neuropathy. You won't be able to do much the older you get. So it's almost like a flight. And again, the underlying issues that you were talking about, yeah, it becomes mental, it becomes emotional. You know, the depression, the anxiety, it's real. This is what everybody's facing because they think that it's a medical answer and there's a pill, a magic pill. And there isn't, man. You know, in our hearts, we have to look for something that's going to make you a little bit better. And there's therapies, there's acupuncture, there's stretching, there's yoga, and there's things that people today want an answer tomorrow, today, later. You know, they can't wait for it. You know what I'm saying? And this is why sometimes people just sit on it, and their mind is almost like a give up. You know what I mean? They feel as if they can't do that, and it's limited, so they'll keep it that way. Now, if you're a fighter, right, you'll kind of step into something else. You look for something that's going to make you better, feel better, so you can maintain a process of exercising your body, keeping yourself healthy, keeping yourself strong, because you still have a lot of years to go. People don't realize that there's 10, 20 more years to go to step into. To sit there and say, well, the doctor said I don't have to do anything, so I'm not going to do anything. Well, how do you think the muscle is going to react? The muscle is going to shrink. The muscle is going to give in. The muscle, and then you're not going to have a muscle. Then the permanent damage creeps in. So you need to have something where you relieve the pressure, you relieve the inflammation, you relieve the pain, so you can do a little momentum. I mean, you don't have to. The older you get, you don't have to maintain the same procedures that you did when you was 20. But you still have to maintain something where you can, be active, be able to be part of the social activities in life. Man. You're not going to be able to move and do things, enjoy your children, enjoy your grandchildren, enjoy life as it is, if you're going to sit there and think, well, let me not move this shoulder because it's hurting. Mm-hmm. You have to step into it. And sometimes that's where your mind frame kicks in. You have to understand. And things like this, where we have a conversation, helps other people understand that there's other and better things. There is a greener side. You know what I mean? A better side.
So you're saying you have to move into the discomfort, right?
Right.
You have to step into it. You have to move into the discomfort. But how do you know that in moving into the discomfort, that's the right thing to do? Because you're getting all this feedback from your body, and you're moving into it. You're trying to work the body, and the body's yelling back at you, hey, this is painful. So how do you know it's the right course as you're going through it?
Well, I think you'll be able to explain that a little bit better. But in my mind frame, when I go through pain, it's almost like nothing's really easy in life. You know what I mean? There's always going to be a little pain. When you're doing exercise and you want to look good and you want to chisel and you want to look like this physique that that's on magazines, there's a little pain that goes through it, right? So the same thing when you have an injury, it's almost as if you have to work on the mobility of it. If you don't work on the mobility of it, it's going to seize, right? And so you have to kind of work through the pain a little bit, little by little, let that blood circulate, because that's inflammation that's telling you don't move it too much. But if you can do a little stretching here and there and let the blood start flowing, you start creating a little bit more healing. And then you have help as far as acupuncture, where you reduce the inflammation, and then you're helping and you're getting that little bit of pain, and now you're getting more blood flow getting through it. And so that's what inflammation is. It's a seizure, not letting the blood flow. And if you're allowing that blood flow with the stretching, with the mobility, you're trying to stretch it to a point where, you're going to feel a little pain, but there's blood going through. You're starting to create healing. The next thing you know, little by little, you're moving an inch more, and you've got full mobility where you're sitting there and you're not, if you give up, you're not going to be able to, everything's going to seize on you. So my point is that you have to work through some pain in order to get to the point that you want to be. Nothing's really easy in life, you have to work through it. So, that's how I've battled. And this is why I am where I'm at. Yes, I overdid it because I like pain and the things that I go through, but sometimes I'm not doing it right. Sometimes you need other people, doctors, to inform you. And then also, we're not getting any younger, and our bodies aren't healing as quick. You got to kind of learn how to shift and maneuver through these new things in life, and that's it.
So you really pay attention, you really listen to the body, okay? But you're working with it. So in listening to it, it's giving you, let's say, negative feedback, some sort of pain, some sort of discomfort, and you're working with it. You're like, well, we're going to move into this pain. We're going to move into discomfort. We're going to work this. We're going to breathe. We're going to move, right? And inch by inch, over time, things start opening up. Things start working. Right. They're just not working the way they did when they were 20, right? But you can still find its capacity. Right. You're in better shape than almost anybody at any age. Right?
Thank you.
It's clear.
Yes.
And so you're doing that at 53. After all the injuries, after the time in the military, we had the injuries there and the car accidents, and you're still doing it at 53. Correct. Right? So you're here as a sort of model saying, listen, this can be done. You can stay in great shape. You can find the capacity of your body, but it takes work.
Yeah, it's a mind frame. You have to do it little by little. You can't jump into something expecting the results. So it's just a matter of time, and you got to do it little by little, especially when you get older. It's your body's going to let you know that there's some days that you can't, and the proper response is rest, of course. And when you used to do it 5 days, now maybe you have to do it 3 days. But you have to find a different route, almost like the way your nerves work when you get hurt, that if it's not going straight through, but your body is so perfect and perfectly made that it'll find a route. The nerves will reroute themselves. And so this is what you're basically doing to yourself when you get older. You're kind of rerouting yourself, making sure that you're getting a different path to get the results that you want. You know what I'm saying?
That's a great way to put it.
Yeah, thank you. So that's it. I mean, I've just been doing it most of my life. I've always been healthy. I try to maintain my family in the same. Like, I've always eaten well. Yeah, there's junk food. I'm not Mr. Diet. I never had a strict regimen. I never did all of that. I just kind of exercised, listened to my body, fed myself well at times, and then at times, you get that little, let me get that pizza, let me get some candy. That's me, you know what I mean? But and then you just need to listen to your body more. Just, I guess, in a sense, you have to let your body just work yourself into a routine, sort of get yourself active. Take that first step, you know what I mean? And just continue it. Being consistent, persistent, not giving up. And like I said, it's little by little. It's not just jumping into it and let me do a couple of sets of this and a couple of sets of that, and the next day you're tore up and you're burning yourself out. It's little by little, and anybody can do it. It's just a mind frame, and it's very tiring, and it is excessive. It's almost like as if a job, as if when you have to get up every morning and say, I got to go to work and I got to do this thing again. Well, you're doing it for your own good, and you're doing it for your longevity, which is better. You know what I mean? Do you want to sit back and let your body deteriorate, or do you want to have those extra long years and not be in a wheelchair, and not be in a walker? You know what I mean? It's a mind frame that you have to kind of set yourself in. And that's what I look at, the longevity of things, And so when I start seeing that there's some things that I can't do that I used to do, or there's a pain that's awkward and not allowing me to, I start kind of concentrating on working on ways to fix little things. And it doesn't always have to be a pill. You know what I'm saying? And this is where you step in, Dr. Clarke. Right?
Yeah. Well, I appreciate you, and I appreciate you sharing this. Is there anything else that you want to share?
I'm good.
You good?
Yeah. Just appreciate the time with you. I'm glad that we continue doing this.
Yeah. Well, thank you so much.
Sure thing. Thank you.
Great role model for folks.
Thank you so much.
Thank you so much.